and welcome to today's Kapnick presentation, the monthly webinar, GLP-1 Drugs Decoded, What Everyone Should Know. GLP-1 medications like Ozempic and Wegovy are everywhere right now, on social media, in the news, and increasingly in everyday conversations. Today, we're going to walk through some of the breakthrough, the noise that we're hearing, and talk about how these medications actually work in the body and what the research really shows. So whether you're taking one, excuse me, or considering one, or just curious, this is about helping you make informed, evidence-based decisions. Before we get started, we'd like to quickly note that this presentation is for educational purposes only. It is not intended to replace medical advice or be used to diagnose or treat any condition. If you're considering medications, supplements, or making changes to your health routine, it's important to have a conversation with your doctor or qualified healthcare provider. And just a quick clarification before we move on, when we say GLP-1 throughout this presentation, we're referring to the medications, not the natural hormone your body produces. We'll talk about both, but we want to make sure we're all on the same page so that it doesn't get confusing. You've probably heard a lot about these medications lately. News headlines, social media, celebrities, medical updates, they seem to be everywhere. And when a topic or trend comes up like this so often, it can begin to feel like a simple solution or even, quote unquote, the next big thing. And there are a few key reasons behind this. They've shown significant weight loss results, which has brought a lot of attention. There's constant social media and social buzz amplifying it. And at the same time, they've become more accessible, and we're seeing them used for more than just diabetes. So what started as a medical treatment has now become a major trend. And that's exactly why it's important to understand what these medications actually do and what they don't do, which is what we're going to walk through in the next few slides. So before we dive into the medications themselves, we need to understand what GLP-1 actually is, because that's where a lot of the confusion starts. GLP-1 is a hormone your body naturally produces. It's released from your gut, specifically your small intestine, after you eat. And it plays a really important role in regulating blood sugar and appetite. It tells your pancreas to release insulin, slows down how quickly food leaves your stomach, and signals your brain that you're full. But here's the key. Your body keeps this hormone on a very tight leash. It only lasts for about a minute or two before it's broken down. So it's designed to work in short, controlled bursts. Now let's compare that to the GLP-1 agonists. These are the medications designed to mimic that same hormone, but in a much stronger and longer lasting way. Instead of lasting minutes, they can stay active in your body for days or even a week. So rather than gently supporting your body's natural system, these medications essentially amplify it. They bind to the same receptors, but create a much more sustained effect, especially when it comes to appetite suppression and blood sugar control. A simple way to think about it is like this. Your natural GLP-1 is like a dimmer switch. It adjusts based on what your body needs. The GLP-1 medications are like someone holding that switch in the on position. And this difference is exactly why these medications can be so effective, but also why they come with important considerations, which we'll talk about later. Now that we understand the difference between the natural hormone and the medication, let's look at what's actually happening in the body when someone takes the GLP-1 medication. Think of this as a coordinated shift across multiple systems, not just one single effect. First, these medications mimic GLP-1 receptors throughout the body, including the gut, pancreas, and brain. More specifically, they activate the same receptors in the body, but in a stronger, longer-lasting way. But unlike your natural GLP-1, which only lasts, like we said, a few minutes, these medications are designed to stay active for days or a week. So instead of that short signal, the body is again experiencing that sustained effect. So let's look at how these medications slow gastric emptying, which means the food stays in the stomach longer. And this directly contributes to the feeling of fullness after eating. They also change how quickly nutrients enter the bloodstream, which plays a role in blood sugar control. At the same time, the pancreas is being affected. GLP-1 medications increase insulin release, but only when the blood sugar is elevated, which is an important safety feature. They also suppress glucagon, which helps prevent excess glucose from being released into the bloodstream. Together, this improves overall blood sugar stability. Next, let's move to the brain, specifically the hypothalamus, which plays a key role in regulating hunger and energy balance. GLP-1 medications target this area to decrease hunger signals and enhance feelings of fullness. This is why many people feel satisfied with less food and why the urge to eat may feel quieter. And finally, this is where newer research adds an important layer. These medications also affect the brain's reward system. They influence dopamine signaling, which is involved in how we experience pleasure and reward from food. This can reduce cravings, especially for highly processed or high reward foods. So for many people, it's not just that they feel less hungry, it's that food feels different. And people aren't having the same emotional experience with the food and as they eat. And over time, that can influence eating behaviors and habits in a meaningful way. So when we look at the full picture, this is not just an appetite suppressant. It's affecting digestion, hormones, brain signaling, and behavior, all at the same time. So far we've talked about how these medications work, primarily through appetite, digestion, and blood sugar regulation. But what's important to understand is that their effects don't stop there. These medications influence multiple systems throughout the body, and that this is where the research continues to evolve. Starting with the musculoskeletal system, when weight loss occurs on these medications, it's not just fat that's lost. Studies show that portion of the weight can come from lean mass or muscle. And that's not unique to GLP-1 medications. It can happen with any significant weight loss, but it's important here because the appetite is reduced. So without enough protein intake or resistance training, muscle loss can be pronounced. There are also some early discussions in the research about potential long-term effects on bone health, but that area is still being studied. So this is where lifestyle support becomes really important, and we'll discuss how important that is a little bit later in the presentation. From a cardiovascular perspective, this is one of the most well-established areas of benefits of GLP-1s. Large clinical studies, including the SELECT trial, have shown a reduction in major cardiovascular events such as heart attack and stroke in certain populations. These effects are likely related to a combination of factors, including weight loss, improved blood sugar, changes in blood pressure, and vascular function. So this is one area where we're seeing a strong, consistent evidence. Another system involved is the renal system, the kidneys. GLP-1 medications can influence how the body handles sodium and fluid balance, which may contribute to changes in blood pressure. There's also growing interest in their potential role in kidney protection, particularly in people with diabetes, although this is still being explored. In the liver, emerging research suggests that these medications may help reduce fat accumulation. And this is something we see in conditions like non-alcoholic fatty liver disease. Some studies have shown improvements in liver enzymes and markers of metabolic health, but this is still considered an area of ongoing research rather than a primary indication. And finally, there's increasing evidence that these medications may reduce low-grade chronic inflammation. This type of inflammation is a key driver in many chronic conditions, including cardiovascular disease and metabolic disorders. While we fully don't understand all of the mechanisms yet, this is another area where research is expanding. So when we step back and look at the full picture, this isn't just a medication that affects appetite. It's influencing multiple systems across the body, including muscle, cardiovascular health, kidney function, liver health, and inflammation. Some of these effects are well established, while others are still being studied. And that's important because it means our understanding of these medications is still evolving. Now let's shift into what we see in the research, because this is where the medications have strong evidence behind them. First, we see a reduction in appetite and overall calorie intake. These medications act on both the gut and the brain to help people feel fuller sooner and stay full longer. This is one of the main drivers of weight loss. We also consistently see improvements in blood sugar control. In fact, GLP-1 medications were originally developed for type 2 diabetes, and they can lower A1C levels by about 1 to 2%. Because of this, they are recommended by organizations like the American Diabetes Association as part of diabetes management. Another important benefit is cardiovascular risk reduction. Certain GLP-1 medications have been shown in large clinical trials to reduce the risk of heart attack, stroke, and cardiovascular death, especially in individuals with type 2 diabetes or existing heart disease. This is supported by major trials and endorsed by groups like the American Heart Association. We also see modest improvements in blood pressure and cholesterol levels. These changes are typically small, but when combined with weight loss and improved blood sugar, they contribute to an overall cardiac profile. And lastly, there is emerging evidence around kidney protection. Some studies suggest these medications may help the progression of kidney disease in people with diabetes, although this is still an area of ongoing research. So overall, the takeaway here is that these medications are not just about weight loss. They can have broader metabolic and cardiovascular benefits, particularly in the right populations. It's important to note that most of this evidence is strongest in individuals with type 2 diabetes or obesity. So now let's talk about something that's just as important as the benefits, and that's the trade-offs. GLP-1 medications are powerful tools, but they are not neutral. The most common side effects are gastrointestinal. That includes side effects such as nausea, constipation, sometimes vomiting, especially during dose escalation. For many people, these improve over time, but not always. Another important consideration is body composition. Weight loss on these medications is not purely fat loss. Without adequate protein intake and resistance training, there can be a lot of loss of lean mass, meaning muscle loss. And that matters metabolically and functionally. We also need to acknowledge that long-term data regarding these medications is still emerging. These medications are relatively new in the context of widespread use for weight management. We understand the short to midterm outcomes well, but the long-term effects, particularly on muscle, bone, and metabolism, are being studied. There's also the reality of cost and access. These medications can be expensive, and insurance coverage is inconsistent. And finally, sustainability. These medications work while they're active in the body, which means for many individuals, they require ongoing use to maintain the effect. So again, they're powerful tools, but not without trade-offs. And that leads to one of the most important questions that people have. What happens when you stop? Here's the reality. GLP-1 medications modify appetite and the feelings of fullness while they're active. When the medication is discontinued, those signals return. Hunger increases, the feeling of fullness decreases, food noise often comes back. And in many cases, weight gain occurs. Not because someone failed, but because physiology resumed. Studies show that a significant portion of weight loss on GLP-1 medications can return after discontinuation if no additional strategies are in place. This is not a willpower issue. It's a biological response, which is why this conversation cannot just be about weight loss. It has to be about long-term strategies. What behavior habits and structures are in place to support the body when the medication is no longer doing what it was doing? Because the medication is a tool, it is not a replacement for physiology. And that's where lifestyle changes and strategies become essential, not optional.
So now let's jump into talking specifically about lifestyle strategies. The first lifestyle strategy is understanding your health, because one of the biggest gaps we see is people taking action without fully understanding their starting point. That starts with knowing your baseline, things like lab values, blood sugar, cholesterol, and body composition, and not just weight, but muscle versus fat. The next step is identifying the underlying drivers. What's actually contributing to your health outcomes? That could be metabolic, behavioral, or lifestyle related. We also need to look at the bigger picture. What medications are being taken? What supplements are being used? And how do they all interact? Because this is rarely just one variable. Working with a healthcare provider helps ensure that everything is aligned and appropriate for your individual needs. And finally, track progress beyond the scale. Because progress isn't just weight, it's energy, strength, lab improvements, and consistency. So before optimizing, understand your health, because you can't optimize what you don't understand. One of the most important things to focus on during weight loss, especially on these medications, is strength or resistance training. Because when weight is lost, it's not just fat. Without the right stimulus, the body will also lose muscle. Strength training provides that signal. It tells your body, this tissue is needed, keep it. And that matters for more than just appearance. Muscle supports metabolism, strength, and long-term weight maintenance. This doesn't have to be complicated or intense. Even a few days per week of resistance training can make a meaningful difference. So while the medication helps reduce intake, strength training helps protect what your body needs. On this slide, you'll also see a QR code. If you're interested, this links to evidence-based guidelines from the American College of Sports Medicine on how to build a strength training plan. You don't need to scan it now, but it's there as a resource if you want to come back to it. Nutrition still plays a critical role. Even though appetite is reduced, food quality becomes more important, not less. Because you're eating less, what you eat needs to work harder. Protein is especially important to support muscle preservation during weight loss. Nutrient-dense foods help ensure you're still meeting your body's needs for vitamins, minerals, and energy. And fiber supports digestion and gut health, which can also help with some of the gastrointestinal side effects that people experience. So this isn't about restriction. It's about being intentional with what your body receives. A strategy in weight loss that is often overlooked is sleep, but sleep plays a major role in metabolic health. Even with medication, poor sleep can disrupt hunger hormones like ghrelin and leptin. This can increase cravings and make it harder to stay consistent with behaviors. Sleep also impacts energy, recovery, and decision making. And consistency is what drives long-term results. So while medication supports appetite, sleep helps stabilize the system overall. This is where everything comes together. These medications can create an opportunity. It can reduce hunger, it can reduce food noise, it can make behavior change feel easier, but it doesn't build habits. And habits are what determine long-term outcomes. Because eventually the question becomes, what remains? What continues when the medication is no longer doing that work? What remains when the support changes? Daily patterns, food choices, movement, sleep. So the goal isn't just weight loss. It isn't just short-term results. It's building something sustainable and building something that lasts. Because long-term health is not created by a single intervention. It is created by what you consistently do, not just what you start. It is created by what you repeat. Before we wrap up today, I want to leave you with a question to ponder. What am I doing today that supports my long-term health? Not perfectly, not all at once, just today. Because everything we talked about, medication, nutrition, movements, sleep, it all comes back to this. The small, consistent things you do every day. So rather than thinking about everything that needs to change, think about one thing, one way you can better support your body this week, and start there. Thank you all for being here today. We hope this gave you a clearer understanding of how these medications work, and more importantly, how to support your health alongside them. And just as a reminder, if you're thinking about making any changes to your medications, supplements, or routine, be sure to work with your healthcare provider to make sure it's appropriate for you. If you enjoyed today's webinar, we have another coming up on April 29th. We'll be talking about credit scores and how they connect to overall health and financial well-being. You can use the QR code on the screen to register if you'd like to join us. And if you're a part of Strive, don't forget to log today's webinar for your reward points. Thank you again for your time, and I hope you have a great rest of your day.